Now we will explain the change in pressure volume loop. Okay, I have already explained this volume loop. Okay, this volume I have already explained it. We will change in the pressure volume loop. Okay, first of all, you have to remember this is pressure, okay, and this is volume. Okay, so here you start from the end systolic pressure. For example, when the ventricle become empty. Okay, after that the isovolumetric relaxation occur. Both the mitral tricuspid and aortic wall are open. This wall and this wall, both of them are closes. Okay, when they are closes, what will happen? Their size increase, the ventricle increase, mean relaxation occur, but it is isometric. No blood move in and no blood move out, because the volume of the blood is same but the pressure is decreasing. So the pressure is decreases here, and it at the end systolic, and it is now it come here, it is end systolic pressure. Okay, and it is end systolic volume. Now after that the relaxation occur when the mitral or tricuspid valve open, so blood move to it. Okay, and actually the ventricle become filled. When the ventricle become filled and the diastole completed. Okay, so after that what will happen? This mitral, here are the aortic wall is closes. Okay, aortic wall closes and the mitral wall is open. And after that, when the end diastolic pressure, when the diastole is complete, this is the end diastolic pressure. Okay, after diastole there is isovolumetric contraction occur, because both this and both of them wall is closes, because now ventricle is full. Now this blood need to move through the aorta. So for that purpose the isovolumetric contraction occur. The pressure of the ventricle is so much increased. When this is so much increased, now the aortic wall open. When the aortic wall open, the ejection occur, the rapid ejection and then reduced ejection. This is rapid ejection and this is reduced ejection. And after the ejection the both wall closes. Okay, the aortic wall closes and the mitral wall also closes. Okay, is already closed, but in the now here the both wall are closes. So at the end systolic pressure and end diastolic pressure, both wall is closes. Okay, you have to remember. And the end of isovolumetric contraction, isovolumetric contraction at the end of isovolumetric contraction, aortic wall is open, and the end of isovolumetric relaxation, the mitral or tricuspid wall is open. You have to remember. Now we will take changes in this loop. For example, first, if you increase the preload, what will happen? This line is preload. Okay, you have to by the basis of the color. If you increase the preload and diastolic volume is increases. How? If you increase the preload, mean more blood is moved in. If more blood is more in, so more blood move out. So more blood move out. But if the end diastolic, here is the end diastolic volume is increases, but the pressure, less pressure is also increased. After that, what will happen? The actually the volume is increased. When the volume is increased, so stroke work is increased. Stroke work is actually pressure multiplied by volume. So if volume is increases, our cardiac output is equal to stroke volume multiplied by heart rate. If the volume is increased, so the stroke work is also increased. Okay, now the second thing is, if in the black color is like this. If you increase the afterload, mean the total peripheral resistance or the resistance to blood is high in the aorta. So what will need high pressure in the aorta? So now more pressure is needed to the this point. Now here is the, this is iso at the end of isovolumetric contraction. Now at the end of isovolumetric contraction, pressure at normal is this, but at the after, if the after load is increased, the pressure is so much high. Okay, after the isovolumetric contraction, so pressure is so much high, so mean but stroke volume become less. Stroke volume now you can see this, the area, the volume is become this is the stroke volume, the distance between two. For example, this is the distance between the end diastolic volume and end systolic this is end systolic volume, end dystolic volume. The distance between them is called stroke volume. So actually here it is decreases. When it is decreases, but the stroke volume is decreased and the pressure is so much increased, so stroke remains stable. Okay, now pressure is increased but volume is decreased, so actually stroke work is decreased, stroke work remains same, not. Okay, you can see it from this diagram. The area of this and this, the area of normal and the area of the afterload is same, because here is volume decrease but the pressure is increased. Now the next thing is called increased contractility. If you increase contractility, it means that the after the isovolumetric contraction, more blood is moved out. If more blood is moved out, so you can see that the stroke volume is increased here. You can see the stroke volume is increased here. More blood is moved out. This is actually normal. This is this is normal. And if you can see, if you increase the contractility for, if you increase the force that eject the blood, so at that time more blood is moved from the normal, more blood is moved from the ventricle. Okay, and that create the volume become increase, stroke volume increase, so stroke work also increase. This is simple phenomena. Stroke work increase in the contractility and also in the increased preload, but at the afterload, if you increase the afterload, the stroke work is remain stable. Okay, now pressure volume work. If you increase the preload and contractility, stroke work is increases. Okay, if you increase the afterload, the pressure load is increased, stroke volume is decreased, but the stroke work is stable. Okay, preload and contractility increase the stroke work, but the afterload increase, not increase the work. Okay, not increase the stroke work. Now another thing is the pressure volume loop. This is the pressure volume loop. So what will happen? This is diastole blood pressure. Actually, you can see from this pressure volume loop, I have already explained, but now there is the time is here shown. 0.55 second is the relaxation pace, and the isovolumetric relaxation is 0.5. So relaxation is actually 0.15 plus 0.55. So how it you can, if you calculate it, it is 0.70 something. Okay, and if you calculate the isovolumetric contraction time and ejection, that is 0.05 plus 0.05 and 0.05 and 0.25, that is actually 0.3. Okay, so this is the time, and here is also the volume. Stroke volume is equal to 70 ml. Okay, stroke volume is 70 ml, and the area between them is called, bigger the loop and bigger the area is called, bigger the stroke work. Okay, you have to remember this. And what is the end, what is the diastolic blood pressure? Diastolic blood pressure is actually the pressure, the diastolic blood pressure. This is diastolic blood pressure. But diastolic blood pressure is 75 mm of Hg, and systolic blood pressure is 120 mm of Hg. Okay, and end systolic volume is 50 and end diastolic volume is 120, and between them the stroke volume is 70. Okay, now we have explained this loop, the pressure volume loop, so you will understand it carefully. Okay, thanks for watching.